Welcome to Pixarize's scene for vitamin D deficiency and excess, part of our series on the vitamins. Our last scene, which covered the biochemistry of vitamin D, took place in a mystical forest that was populated by a number of cute vitamin D deer. This scene has a more prehistoric vibe, but the vitamin deer are back and they're just as cute. Let's flesh this out, starting with the deer in the foreground that's fresh out of flesh. See what I did there? Word. This area of the image is going to cover vitamin D deficiency, and the vitamin deer here seems to be deficient in a lot of ways. Notably, it's deficient in life. Yep, he's dead. First, let's check out the crickets crawling along those dead, deficient vitamin D deer bones. The crickets are there to represent the disease rickets, the name for vitamin D deficiency in children. In adults, vitamin D deficiency is called osteomalacia, and it's mainly defined by muscle weakness and bone pain, but exam writers are more likely to ask you about the childhood form since it's accompanied by a number of testable bony deformities. These bone problems should make sense to you if you watched our scene on vitamin D function. Vitamin D signals the intestines to absorb calcium and phosphate, and in a D-deficient state, less calcium and phosphate are available for bone mineralization, which will then lead to deformation as the bones grow. Notice how the ricket crickets are lining up along the ribcage of the D-deficient deer? This represents the rachitic rosary line, a line of visible bony nodules on each of the costochondral joints of children with rickets. Below the cricket-ricket rosary line, we see that the lowest rib of the skeleton is still covered in fur. Wait, there's fur on the bone? Whatever, don't question it. This hairy last rib is there to help us remember Harrison's groove, a deep depression along the diaphragmatic boundary of the rib cage, seen in children with rickets. Hair for Harrison. And check out that hunter cave child bending over the deer carcass to pick up his bow, which sits where the deer's hind legs should be. He's strategically placed his bow here to help you remember the finding of bow legs. Bowing of the legs, or genu varum, is the result of long bone weakness in rickets, and it's probably the symptom most associated with the disease. The child bending over should also help you remember kyphosis, an excessive outward curvature of the thoracic and sacral vertebral regions, a non-specific finding in rickets. And finally, the broken bone he's holding represents the frequent fractures and bone pain common across all vitamin D deficient patients in osteomalacia or rickets. So, let's summarize the symptoms of cricket rickets. The cricket line on the ribs represents the rachitic rosary line. The hair-covered last rib on the skeleton represents Harry Harrison's groove. The bow represents bow legs. The bent-over kid represents kyphosis. And the broken bone he's holding represents fractures and bone pain. Alrighty, let's move on to some of the causes of a vitamin D deficiency. Direct your attention to this young cave mother standing beneath the shade of a tree with her tiny baby. The shade she's basking in is there to represent low sun exposure, a cause of vitamin D deficiency. Since vitamin D3, or cholecalciferol, is synthesized in the sun-exposed cells in the stratum basalis of the skin, limited sun exposure can cause a vitamin D deficiency. Next, check out that cave woman war paint on her face. That's there to remind us that pigmented skin can be a barrier to sun absorption, which can then cause a vitamin D deficiency, as we already discussed. Now, onto her tiny baby, which actually represents two causes of vitamin D deficiency. First, notice how our baby is extra small. He's small to remind us that prematurity is a risk factor for vitamin D deficiency. This occurs since the fetus is unable to produce its own vitamin D and is completely dependent on transplacental transfer from the mother. This transfer predominantly happens during the third trimester, and thus preterm infants are at a higher risk of vitamin D deficiency. And see how he's reaching out for his mother's breast? That's to remind us that breastfeeding without supplementation puts babies at risk as well, since breast milk contains very low levels of vitamin D. After birth, babies have an even tougher time getting enough vitamin D since it has to come from the diet and exposure to the sun. It's not easy to balance the benefits and risks of sun exposure on infants, and most babies don't receive enough to satisfy their vitamin D needs. That's why all babies are recommended to start on vitamin D supplements shortly after birth, especially if they are exclusively breastfed. Hopefully our caveman family has vitamin supplements wherever they live, and hopefully they let him out of that swaddle to catch a few rays. Let's turn our attention to the cave guy in the center of the image and talk a little more about the general sequelae of a vitamin D deficiency. As mentioned in our last video on vitamin D biochem and function, a lack of vitamin D leads to a lack of intestinal absorption of both calcium and phosphate. Take a closer look at what this guy just dropped. It's our calcium ice cream pint, our recurring symbol for calcium and apparently a great lure for hunting deer. He's dropped it to remind us of hypocalcemia, or low calcium levels, in vitamin D deficient patients. The fact that these cave people have ice cream is making me think that that preemie could be receiving vitamin D supplements and isn't going to get rickets. That makes me feel good. If we turn our attention to his back, we'll see that he's tastefully draped a fox pelt from his belt line. I believe this is very fashionable in his village, or tent, or cave, or whatever. Since foxes are a recurring symbol for phosphate, this low-hanging fox is meant to remind us of low phosphate, or low phosphate levels in the setting of a vitamin D deficiency. Now, do you see that llama in the background? I'm kidding. Obviously, that's an alpaca. Do I look like the type of idiot who wouldn't know the difference between a llama and an alpaca? Actually, yeah, I look like that type of idiot, but you don't know that. Anyway, this alpaca represents an elevated ALP level, or alkaline phosphate level, since, he's an alpaca elevated on a hill. And if we look even closer, we'll see that he's gripping a couple of neckties in his mouth. I guess he just got off work. Or maybe he stole them from our caveman family. Whatever. This pair of ties is our recurring symbol for parathyroid hormone. Both the alpaca ALP and pair of ties parathyroid hormone are elevated in the setting of a vitamin D deficiency. Elevated parathyroid hormone signals a need for more calcium, so it should make sense to you that it would be elevated when calcium levels are low, like they are in vitamin D deficiency. Finally, you're probably wondering what this dude is doing with his hands. Looks like he's hitting himself in the face because he should have had a V8. Oh, just kidding, he's clearly shocked by what he sees in the distance, but we'll get there in a bit. His contorted face should remind us of Chvostek's sign. Chvostek's sign is a spasm of the cheek that occurs in patients with hypocalcemia in any underlying cause, vitamin D deficiency included. And if we check out his other hand, we'll see that it's contorted as well. Notice that on that arm, he's wrapped a fur band around his bicep. Man, this guy was just styling on all these hunter fools. This fur band is meant to remind you of a blood pressure cuff, and his contorted hand should remind us of Trousseau's sign, the contorting of the hand in response to a blood pressure cuff being applied. This is another general symptom of low calcium hypocalcemia. Alright, we're almost done. We just need to cover a couple of features of vitamin D excess now that we know so much about vitamin D deficiency. Check out the big group of deer on the right. So many vitamin D deer. Looks like all these delicious deer were the cause of our guy's Chvostek evoking shock. Shouldn't be hard to remember that this area of the image represents D or deer excess. Let's start by introducing you to our granny. She's been one with the land for ages now and has become friends with all of the deer, which she's attracted with her favorite food, calcium ice cream. Look at her hoist that hefty tub high. Granny's still got those delts. Anyway, this symbol is a two-parter. The granny is there to represent granulomas, or granulomas, if you will. Granny granulomas contain a high density of epithelioid macrophages, and these cells express alpha-1 hydroxylase. Recall from our scene for vitamin D biochemistry that alpha-1 hydroxylase is the enzyme normally present in the kidneys that converts vitamin D from its storage form, 25-hydroxy-D3, to its active form, 1,25-hydroxy-D3. Well, it turns out alpha-1 hydroxylase is found in these macrophages, which are densely packed within granulomas. In diseases with lots of granulomas, vitamin D is overactivated. Let's further explore what the symptoms of too much vitamin D look like. Focus your attention on the raised calcium ice cream our granioma is holding high above her head. Elevated vitamin D leads to increased absorption of calcium in the small intestine, and lo and behold, or high and behold, Granny is raising her calcium high to remind us of hypercalcemia and consequent hypercalciuria in the setting of vitamin D excess. Lastly, there are only a couple of important symptoms of a vitamin D excess that we have to cover. First, check out that one deer just napping instead of going after the ice cream like his friends. This too cool for school deer should help us remember the stupor and cognitive slowing that can manifest in D excess. Now look at his friend above him spitting out all that grass to make room for more ice cream. This fella spitting out his bland, planty meal should help us remember the loss of appetite seen in patients with a vitamin D excess. Both of these symptoms are nonspecific and are thus pretty low yield, but we've included them for all of you 270 plus gunners out there. And that's it. Everything you need to know about vitamin D deficiency and excess. Another vitamin down. Now that you've visited the forbidden forest of vitamin D biochemistry and met the hunter-gatherers of vitamin D deficiency and excess, you should be able to survive the boards and live a great life before ultimately returning to the dirt and becoming one with deer skeletons like the one from this scene. Hooray for the circle of life. Until next time.